and thank you for tuning in. When it's Monday, we know it's Healthy Monday. Karibu sana, this is Health Nuggets, and today we are all about saving lives. So we'll focus on administering different kinds of first aid. Stay tuned. Health Nuggets starts now. So it is a how-to episode of Health Nuggets. As mentioned, we are looking at administering different kinds of first aid. And since I'm not an expert, two amazing ladies from St. John's Ambulance will take us through. Remember, in case of an emergency, a first aid could save a life. So stay tuned. Let us learn together.
I would like to demonstrate to you what you do to a casualty who is unconscious and not breathing, and specifically a child and an infant. An infant is a baby who is between 0 to 1 year, and a child is someone who is from 1 year to around 10 to 12 years. So the very first thing that you do as a first aider is to ensure your own safety. So the first thing that you do is to ensure that you have your PPE, and with me here, I have some gloves, which I'm going to show you how to wear. You flap it, and then you roll it. You start with your thumb, and then the rest of the fingers just fit in, like that. See? So you do the same thing with the other one. You roll. So, for a child who is not breathing, how you know that a child is not breathing is in two ways. One, you actually observe the up and down movement of the chest. Normally when someone is breathing, their chest actually moves up and down. That's the first thing. So if their chest is not moving up and down, it probably means that they're not breathing. The second thing that you can do is you actually move closer to their ear, like this, and just feel if you can actually be able to feel their breath. Because normally when someone is breathing and do that, you can actually feel it on your face. If they are not, then that means that they're not breathing. What we do in such a case is CPR. Basically what CPR is the aim of CPR is to restart their heart. There are two things that are comprised in CPR. The first one is chest compression, and the second one is rescue breaths. Rescue breaths is what people usually refer to as mouth to mouth. So for a child, the very first thing that you do is you give them 5 rescue breaths. The reason is children and babies normally lose a lot of oxygen whenever they're not breathing, and therefore the first thing that you want to do is to ensure that the body actually has oxygen. So for you to do that to a child, what you do is you lift the chin, we call it chin up, head tilt, and then you pinch the soft part of the nose, which is this part, like this. And then you give them 5 mouth to mouth. As you can see, whenever I did that, the chest is rising. So whenever you give the rescue breath, you should ensure that when you do it, the chest rises. So the second thing, after you have done that, the next thing that you need to do is to give chest compressions, which we do at we give 30 chest compressions. And for you to do that, you need to locate the center of the chest. And this is how you do it. You put your both hands this way, and then you move them at the same pace. And where they meet, that is the center of the chest. What you do is you use your strongest hand, just one hand, and you place it there. And then now you do the compressions at a rate of 100 to 120 per minute. Actually, it's usually said that you can actually do it at the rate of the song Staying Alive. So you do 30. As you can notice, you're supposed to be on top and your elbow should be straight. So that when you do it, you ensure that you actually move about 4 to 5 centimeters on the chest. After you've done 30, now you're going to give 2 rescue breaths. So you're going to pinch the nose once again when you've tilted the chin, and do it once more. 2. From there, you're going to continue to repeat the same process, 30, 20, 30, 20. So the point is you start with 5 rescue breaths, 30 chest compression using one hand, and then 2 rescue breaths, then 32, 32. The difference between a child and an infant comes to when you are actually doing the chest compressions. So for an infant, instead of using your hand, you actually use 2 of your fingers. So you do the same exact thing. You give 5 rescue breaths. And in this particular case, you do not pinch a baby. You actually breathe into their mouth and nose. You see, the chest was rising and falling. And then you give 30 chest compression. And in this case, you're going to use your finger. So you're going to locate, it's actually here. You can actually put it on the 2 breasts of the kid and do this, it's here. And then you do 30 at the same pace. You continue doing that until they're 30. So you keep doing, after you're done 30, you're actually going to give them 2 rescue breaths, just the same way that you did with the child, and then continue the whole process. Before you actually begin to do CPR, you should consider actually calling for help, whereby you can actually take your phone and call for an ambulance. You can do it on loudspeaker as you continue to do the chest compressions. Then keep repeating the same cycle of 32, 32, until help arrives, or until the patient, the casualty is actually able to breathe on their own. And that is how you save a life. I'd like to show you the first aid that you perform to a casualty who is unconscious and breathing. When you find a casualty who is unconscious and breathing, you can actually tell that a casualty is breathing by the upper and lower movement of their chest. My wonderful colleague here, Sally, is going to act as our casualty for today. So if you find that a casualty is unconscious but is breathing, what you need to do is actually put the casualty in a recovery position to ensure that their airway and breathing is well opened and they're able to breathe. So the very first thing you do is you're supposed to move the casualty towards the side that you're on. In this particular case, since I'm on this side, I'm actually going to move her. You're going to lift the leg like this, and then take the casualty's hand and place it here. And the other one, you place it right here. Then you hold the casualty here and here, and then move them towards you, like that. You ensure that you have put this leg in this way, so that way it's supporting her so that she does not tilt over. And then you come and ensure that their head is lifted and their head is tilted and the chin is lifted to ensure that they are breathing properly. And that is how you save a life.
Well, remember, you can always learn at your own pace. These videos will be uploaded on CAC TV social media pages. There is Facebook and YouTube at CAC TV Kenya. So that was how to administer first aid in case someone around us is unconscious and not breathing, or if someone around us is unconscious and breathing. So Sally Beth from St. John's Ambulance will now take us through the first aid to do if someone around us cuts themselves, or if someone around us is nose bleeding, or if someone around us faints.
So fainting normally occurs when the brain does not receive enough oxygen. And what triggers is maybe when somebody is hungry, or maybe somebody has been standing for a very long time. And this is what you need to do. So when someone has fainted, you need to loosen any tight clothing. In this case, our casualty, we are going to open this jacket just to ensure that she is free. If there's a belt, yeah, you open the belt. Yeah, just ensure that. Then remove the shoes. Ensure that your casualty is as free as possible. There's nothing that is holding them. And then, so the main aim here is to ensure that the brain gets oxygen. And in this case, we are going to raise her feet higher than the level of the heart. So we're going to use this blanket. You can use one in your house. So as you can see, still she's a bit low. We can add another blanket until, okay. So, and the main reason we're doing this is just so that the blood can flow to the brain, and within a few minutes, your casualty is going to recover. And that's how we save a life. We are going to demonstrate to you what to do in the event somebody is nose bleeding. So normally, nose bleeding is caused when the blood vessels in the nose burst. And this occurs maybe when the weather is too hot or too cold, basically change of temperature. It also occurs when you accidentally prick your nose while picking it, or maybe when somebody or something hits your nose hard. So what you need to do is to ensure your casualty is comfortably seated and let them pinch the soft part of their nose. They can breathe using their mouth and let them lean forward. So after 10 minutes, they can stop. Just stop. We check to check if the nose bleeding has stopped. If it has not yet stopped, continue for another 10 minutes and then check again. If it has not stopped, you can do it for another 10 minutes. However, if nose bleeding goes for more than 30 minutes, seek medical assistance. That's how we save a life. So kuna ile time uko kitchen, unapika, unakata nyanya kitunguu, by mistake, umejikata. Damu imeanza kutoka, unashanga, what do I do? So in the event of a cut, this is what you do. Just tell the casualty to apply pressure, your place penye amekatwa. So just finyilia hapo tu kwa nguvu. Finyilia kwa nguvu. Maybe you can just sit so that you can support your hand, usichoke. Yeah. You can just place it here. Yeah. Finyilia kwa nguvu. And then ensure that they elevate their hands higher than their heart level. So after some time, like 10 minutes or so, the bleeding should stop. So what you can do is just to wash the area with clean water and then tie it using a bandage. So this is where has been cut. So you just tie the reason why you're bandaging it is so as to avoid infection. Because when you expose a wound, it can pick germs from the environment and it becomes septic. Then you can just tie it here. Make sure you don't do it so tight so that you do not stop circulation of blood. And that's how we save a life.
Now, a fracture is a broken bone, and this can occur from a car accident, from a sports injury, or from a fall. Now, we're going to look at the first aid to administer in case of an arm fracture and a lower limb fracture.
One of the very key things about performing first aid is always ensuring your own safety by always ensuring that you have worn your gloves. So I'm just going to wear them. If you do not have gloves at home, you can always use something else, like say a polythene paper. Yes. So, the very first thing that you do when someone has a fracture, let's take for example that she has a fracture right here. The one thing that you actually want to do in such a situation is to ensure that the leg is at a standstill position, because of course whenever it moves, the casualty is going to actually feel pain. Say the casualty has probably gotten a fracture around this area. The key thing that we need to do here is to reduce the amount of movement of the bone around that area, because it's going to cause more harm and of course pain to the casualty. So once you have ensured that the leg is straight like this, what you need to do is to splint the leg. To splint, you actually need to use something that is hard. You can choose to use a cardboard, or you can even use a cooking spoon, the wooden one. Just to place it, you place one here and another one here. But say, for example, you're out there and you don't actually have something to do. What you do actually is you use the other leg to split as a splint of the leg that is injured. So if, for example, the casualty is injured on this area, so you're going to get something. It can be a cloth or a belt, anything. Ideally, what you want to do is to secure the legs. So if, say, the fracture is here, we are actually going to form it right here. So you're going to ensure that her feet are straight, and in this case, we are using this leg as the splint of the one that is injured. So you're going to tie right here tightly So that's the legs are together like that. And then you're going to have another one, which you're going to put on this area. The reason for doing this is our greatest aim is to ensure that the leg does not move as we are waiting for further and more professional help to get here, or if we are moving the casualty to the hospital. So you have another one right there. So this leg acts as the support for the other one. That is if, for example, it's this area. If, say, the casualty has at their leg on the lower part, in this particular case, you're going to do it upper. Ideally, what you do is you have to have one bandage tied on above the area and another one on the lower side of that area. Okay, so if, say, she has injured herself here, you should have one here and another one around this area. And then once you've done that, now you can move the casualty to the hospital. We are going to demonstrate to you how to give first aid to someone who has an arm fracture. With me here is my colleague Sally, and she's going to act as our prop. So depending on where a person has a fracture, we usually do a sling. A sling is mostly done using a triangular bandage. As you can see, it's in the shape of a triangle. It has the long ears and the short ones. We usually encourage people to have first aid kit boxes at their homes and workplaces because triangular bandages are one of the items in a first aid kit. So I'm going to begin by showing you how we tie an arm sling. An arm sling is usually done if someone has fractured the area of the arm around this area. If, say, for example, the fracture is here, or if they're fractured, say, their shoulder, especially if it's the clavicle. So the first thing that you do is you hold the short ear, this one, and the short ear of the triangular bandage always goes to the elbow. Begin, kindly support your hand. You request the casualty to support the hand. So the first thing that you do is you put the bandage across the chest like that. Then you request them to put it there. Ensure that the short ear of the triangular bandage is at the elbow. Then you're going to lift this side like this. You're going to tie a knot at the back. You should always tie a knot that is easy to untie once you get them to a more qualified person. And then you come to the elbow and you do this. So you roll. You can use a pin to ensure that this is actually firm, or you can use tape, or maybe if you do not have that, then you can simply tuck it in like this. So this is an arm sling. When you do an arm sling, it usually helps to ensure so that you reduce the weight on the hand, and always ensure that when you do it, it is on a 90-degree. You say, for example, the casualty has hurt themselves from this area, this side, or maybe the rib area. The main aim of us doing a sling in this particular case would be to ensure that we reduce the amount of weight that, say, is on their ribs. In this particular case, what we do is an elevation sling. So you request the casualty to kindly put your hand there on the shoulder. Then you're going to take your triangular bandage. You're going to put it like this. As I said, this should always be at the elbow, like that. And then you're going to tuck this side under the arm. One of the key things that you should ensure is you tuck the sling properly under the arm so that you're actually able to reduce the weight that is lying on the hand. And then you're going to tie it at the back. Come once more like you did the very first time. And do the knot right there. And tuck it in. So once they're in this position, now you can be able to actually move them to an hospital where they can get a more professional help. And that is how you give first aid to a fracture.
Now, choking occurs when the airway is blocked. Coming up next is the first aid to administer in case a child around us is choking and in case an adult around us is choking.
I'm going to demonstrate to you what to do if a baby is choking. Ideally, choking occurs when the airway is blocked by, say, a solid item like food. This mostly occurs when probably you're giving the baby food or when you're moving a baby from actually breastfeeding to weaning. So when a baby chokes, there are two things that you should do to a person when they're choking. The first thing is usually back blows, and the other one is chest compression for the baby. So the first thing you do is you turn the baby like this. Ensure that you're supporting the baby's head like this, and you ensure that you're not actually leaning on the neck. So you're going, and you also ensure that the head is on a lower level than the back. So we are going to give the baby 5 back taps. So 1, 2, 3, 4, 5. You give up to 5 as you check if whatever is choking the baby has actually been able to come out. If it hasn't, then you're going to turn the baby towards you like this. Remember to support the head and ensure that the head is on a lower level once more, and then you're going to give up to 5 chest compressions. 1, 2, 3, 4, 5. As you do that, kindly ensure that you're looking to see if you can see whatever the food that had been choking the baby, and if you're able to see it, just scoop it out with your smallest finger. And kindly ensure that you do that only if and only if you're actually able to see it. Because if you try to do that and whatever has been choking the baby is not really close by, you're actually going to push it down further. So keep doing that until you actually, whatever has been choking the baby is able to come out. And that is how you save a child's life. We are going to demonstrate to you the first aid that you can give to an adult if they are choking. So the very first thing that you do if someone is choking, which mostly occurs because of a solid thing, are you choking? Kindly try and cough. If the casualty is not able to cough and whatever they have is not usually coming out, the first thing that you need to do is to give them back blows. You stand behind them, support them, and then you give back blows. 5. 1, 2, 3, 4, 5. If after giving up to 5 back blows, whatever had been choking the person, the casualty has not actually come out, you stand behind them, then you give them abdominal thrust. What you do is you locate the navel, and then just above the navel, you fold a fist just above the navel, and then you push in and up. 1, 2, 3, 4, and 5. If whatever was causing the choking is not actually able to come out, you continue doing the same, giving up to 5 back blows and 5 abdominal thrusts in and upwards until whatever is choking the person is actually able to come out. If, say, for example, whoever you're performing this first aid to is a pregnant woman, what you do, instead of doing the abdominal thrust, you actually do it on the chest. So you're going to put one of your arms right here and the other one on top on the chest, and then you're going to do the same exact thing. Have your fist and this, and then you do the same thing. 1, 2, 3, 4, 5. The only difference is in this particular case, instead of the abdominal thrust, you actually do it on the chest. And that is how you save a life.
We are going to demonstrate what to do in the event of a burn. So maybe you are cooking, or maybe you're ironing, or maybe you touch a hot oven and you get a burn. So many people get worried, but you should not worry. This is what you can do. Run the burn on cold water, cold running water, for at least 10 minutes. And the reason why you do that is so that you can cool the burn. After then, just cover the burn with a sterile, non-stick piece of clothing. In this case, we're going to use this bandage. So you're just going to cover the place. So the reason why we are covering is just to prevent infection. And also, you know, normally when you experience a burn and the wind blows over it, it's normally painful. So once you cover it this way, it reduces the pain and also prevents infection. So this is it. However, when you're in the house and you do not have a bandage, remember that you can always use a clean polythene bag or a kitchen cling film. So there's a rule that goes, when the burn is bigger than the size of your palm, rush to the hospital. That's how we save lives.
Now that is all we had for you on this episode of Health Nuggets. Special thanks to Sally Beth and Judy Gasheri from St. John's Ambulance on that very informative session on how to administer and save life on different emergency circumstances. Thank you to you, dear viewer, for tuning in. Let's do this again next Monday and every other Monday right here on CAC TV for Health Nuggets. Remember, the videos will be uploaded on our social media pages. That is CAC TV Kenya on Facebook and YouTube. I've been your host, Ida Munzatsi. Always remember that your health matters.